Good afternoon all. My topic for today is optical coherence tomography imaging of proximal lacrimal system. There is no financial disclosure. Anterior segment OCT is a safe, non-invasive, reliable and reproducible method of high resolution cross-sectional imaging of for tissue microstructure using infrared radiation. It is a resolution of 1 to 20 micrometer and can penetrate approximately 1 to 2 mm into the tissue, and it may help to determine which patient would benefit from autoplasty and may help to predict patient with lacrimal pump failure or functional lacrimal duct obstruction in home. Punctoplasty may be effective. The aim of this study is to investigate the potential use of OCT for imaging the punctum and proximal canaliculi. And OCT is a practical and readily available tool in most of the eye clinics in India. And OCT images of the lower puncta were obtained using a top-1 3D OCT machine, and the punctum was identified in odd 52 cases scanned from 28 individuals, and an anterior segment module was used. Both eyes were examined, and a stable ambient room light was maintained during the examination. And the gentle eversion of the medial part of the lower lid was performed to expose the eyelid punctum. Otherwise, you are going to get nothing if it is more everted. This is the correct image of puncta. These are the dimensions of the proximal lacrimal system in all these studies. And however, even the longest canaliculi that we have imagined was 1.2 mm, was still much shorter than 2 mm, whatever previously told to us or whatever we have studied. Therefore, some further explanation is required. As the wall of the canaliculus often appear to come together in a V shape, it is difficult to decide at which point of measure the diameter of the canaliculi. And this data may question the theory that the canaliculi are pulled open when the eyelid open, or whether the figure of 2 mm is accurate or inaccurate. There is a paucity of cadaveric anatomical studies detailing variation in the length of inferior vertical canaliculus. Probing with syringing may be similarly unreliable. There are no routinely used imaging modality for the proximal lacrimal system, and development of an objective system for imaging the punctum is warranted. And this study has several limitations. Firstly, the eyelid margin needs to be averted to expose the lacrimal punctum, which may cause artificial error. Secondly, the age span of the full interval 19 to 73 years. A larger sample size with different age group is required to establish the normal range of OCT. Anatomical parameters in different age group, and accurate imaging and measurement of the punctal size in the OCT technology will play an important role in diagnosing punctal stenosis and guiding the diagnosis and treatment of the clinical punctal disease. Punctal stenosis is one of the major cause of PP4. It's good, correct, Karaji? Yes. The conclusion is that OCT can be used to measure the anatomical parameter of the lacrimal puncta and the vertical canaliculus in vivo. And the anatomical parameter measurement when the eye is open and closed provide objective evidence for the lacrimal pump mechanism to some extent, and OCT punctal lesion can provide an objective basis for the clinical diagnosis and treatment. Those are my references. Thank you.
Very nice initiative. It's nice. Have you done this thing for children also? Only for adults you have used your OCT?
Only
for adults you are doing, or you tried it?
Only for adults. In children,
You didn't try for children, yeah.
Actually, I am generally only puncta is here, so 1.2 to 1.8 maximum. Yeah. Roughly 1.2 to 1.8 in between.
Okay.
So your clinical assessment of punctal stenosis and then doing it with this.
Yes.
So how many times you found that it had an upper hand over your clinical assessment?
Most of the time it has upper, because I have never get 2 mm of the punctal, whatever we have taught earlier.
Thank you.